Everybody ready? All right. Well, hello, thanks for coming today. I'm going to talk about voodoo flossing the ankle for grade 1 and grade 2 ankle sprains. Before we get started, I want to talk about some indications and contraindications. If you think it's fractured, don't want to do this. If you think it's a grade 3 ankle sprain, you don't want to do this. Where this come from was an in-service we had with Major Henry. And where this method come from was Special Forces. They were over in Afghanistan, rolling ankles, going up and down the hills, and they basically called Kelly Starr and was like, we don't have any eyes. You know the standard practice for when you roll your ankle. He was like, well, that may not be the best evidence right now, and he said get a old bicycle tire, like the inner tube inside, cut it down the middle, wrap it around the ankle, and take them through some passive range of motion. With that being said, this isn't backed by any type of evidence-based medicine. This is just basically what we've seen in the clinic and what we found to work. The reason I think it works good for the military setting is because we don't have a lot of time with the people. So if it's a grade 1 or a grade 2, we just want to get them back out as quickly as we can. And this is Jeff, my model. So why don't you just go ahead and lay down on your back. What you're going to do, you're going to have them just lay down on the floor. First, you'll go through your evaluation and make sure it's not fractured or anything else. You're going to have him bring up his foot. So let's bring up his foot. Just kick this one out. And when you wrap it, you want to think about wrapping an ace wrap on there. So you're going to start with a pressure gradient. So this is just going to get it on there. All right. Then you want to get a little taunt, about 75% of what it is. You can come around, wrap it around the ankle. Okay. So come up, keep wrapping. You're going to keep that same consistency on it. Do it a couple times. Then when you start going up the ankle, you're going to cut down on the pressure. Because again, we want to make a pressure gradient so we can work with lymphatics with this. All right, so we get here, we're going to tuck it in. You're going to support the back of his ankle, then you're going to passively dorsiflex. Now, you probably want to prompt this and tell him it's going to hurt. It's not going to be too comfortable. Don't be alarmed if you're doing this and you feel a lot of popping and cracking in the ankle. All right. So usually, what I do, I usually let pain be the guide. I usually try to do 10 at the beginning, then work my way up to 20. So you can do about 4 to 5 sets within a session. Then you're going to have them bring this off and wrap it. Then what I like to do in between is just have them walk around to see how it feels. As it goes along, you should be able to do more. Like I said, start out at 10, work your way to 20. The reason I think this works a lot better than icing is we are taking advantage of lymphatics. We are making that pressure gradient, and we have them laying down. We have everything getting pushed back to the heart. And again, we need to get people back pretty quickly with anything. And you can have them come in 2 times a day if that's what you can. Usually, if you have them come in 3 days in a row, that'll be the best thing that you can do. But again, it's not backed by any evidence. It's just what we found here that works pretty well with anything. It's pretty straightforward. Usually, you can get voodoo floss. You can get that from Rogue Fitness, or you can get just the thickest TheraBand you have in your athletic training room to do it. You can also carry it around your kit if you're out at any training events or anything like that. So it's just immediate care. But the take homes is make sure you don't think it's fractured. It's a grade 3. You can even do it if it's bruised pretty well. It's just going to be painful with anything. And if you do feel some popping and cracking in there, you can do a talus reset. We won't talk about that now because that's just a whole other technique with anything. If you have any questions?
Now, you've said that it works good for swelling at the ankle. Does it work good for swelling at other joints as well?
Mm-hmm. You can use it at the knee, you can use it at the shoulder to get some swelling out and help with range of motion as well. So if someone has just a grade 1 knee sprain, you can wrap it around the knee and you can have them do knee extensions and knee flexion. That should help pretty well with that. What I've seen it work pretty well with the shoulder is that they're lacking internal and external rotation. You can just put it on there, have them lay on the table, and push down. Get them in internal and external rotation.
When it comes to muscle strains, is this also a useful technique to use it upon?
You can, if you don't, again, if you don't think it's like in that grade 3 area. It works really well with muscle soreness, especially if they've had, like if you're working with cadre and they've had a pretty good leg day. You can just wrap around the muscle, help them do some squats, and what it's doing is just going to compress the muscle and help with some shearing force. Again, that's sort of what they think it does, but there's no evidence to back it up.